Welcome back to the Deep Dive. Today we are plunging headfirst into a really critical health topic that, it impacts millions of people globally. The serious complications of diabetes.
It's a huge topic, and we've pulled together some research that doesn't just list the problems, it gets into the how and, maybe most importantly, the when.
Exactly, the timeline.
Yeah.
But let's set the stage first, because the context here it's pretty alarming.
It really is. The sources we looked at rank diabetes as the third most dangerous chronic disease in the world. It's just behind cardiovascular disease and cancer.
Wow.
Yeah, and that tells you right away this isn't just a simple blood sugar issue. It's a systemic threat that touches almost every part of the body.
And the thing is, the driver behind almost all of this devastation is, well, it's a pretty simple concept. It's just long-term, uncontrolled high blood sugar.
Yeah.
Glucose.
Right.
It's like having these tiny sharp sugar crystals just circulating in your blood, slowly grinding away at the most delicate parts of your body.
That's a really powerful way to put it. And our mission today is to, break down that damage, to understand the timeline, how it hits the small vessels versus the large ones, and then extract the really essential, actionable steps for managing it.
We're basically giving you a shortcut to understanding the true stakes of control.
Exactly.
So let's jump right in. The central question I think everyone has is, how long after I get diagnosed do these problems actually start? Is there some kind of a grace period?
That's the million-dollar question. And the answer is, well, it's complicated. Generally speaking, the chronic complications, the slow, silent damage, they usually start to show up about 5 to 10 years after a diagnosis.
Okay, 5 to 10 years.
If, and this is a big if blood sugar control has been poor. But here's the kicker, especially with type 2 diabetes.
The clock was already running.
The clock was already running, yes.
Yeah.
You have to factor in what's called the pre-diabetes phase. This is a period where your blood sugar is elevated but not quite high enough for a diagnosis.
And that can last for how long?
Another 5 to 10 years.
Wow.
So the damage, particularly to the small vessels in your eyes and kidneys, it's often already well underway by the time you get that official diagnosis.
So you walk into the doctor's office, get the news, and you think you're at the starting line. But really,
You could be halfway through the race already. It's a silent countdown, and it demands immediate action.
and that's all very different from the acute complications, right?
Completely different. Those are the sudden, life-threatening emergencies. And they can pop up anytime, even right at the beginning.
Okay, let's break down that slow chronic damage first.
Yeah.
Starting with the small vessels, the capillaries. This is where the sources talk about a microvascular trifecta.
Right. And the first part of that trifecta is our vision. We're talking about diabetic retinopathy.
Which is the leading cause of blindness in these patients.
It is, yeah. The high glucose damages the tiny blood vessels that feed the retina. They swell, they leak, and then the body tries to compensate by growing these new, very fragile vessels.
Which just makes things worse.
Makes it much worse. They can hemorrhage easily, cause scarring, swelling. It's a mess.
And the really insidious part, I think, is that you don't notice it. The symptoms, like blurred vision, they only show up when the damage is already severe.
Which is why the sources are so insistent on annual retinal checks. No matter how well you think you're seeing, early detection makes treatment incredibly successful.
Okay, so from the eyes, we move to the kidneys. Diabetic nephropathy.
The main reason for chronic kidney failure in this group, it's a similar mechanism. Think of your kidneys filters, the glomeruli.
Right.
When they're constantly bathed in high sugar blood, the filter membranes thicken and harden. It's like pouring sticky syrup through a coffee filter over and over again.
It just clogs everything up.
It clogs it all up, and the kidney's ability to filter waste just plummets.
And just like with the eyes, you don't feel it happening until it's really, really advanced.
Correct. It's completely asymptomatic until you're in the late stages. And here's a crucial point the sources make. High blood pressure acts like an accelerator. It dramatically speeds up the kidney damage.
So you're fighting a war on two fronts, glucose and blood pressure.
You absolutely are. And the third front is the nervous system, diabetic neuropathy. The numbers on this are staggering up to half of all patients experience some form of nerve damage.
So how does sugar physically damage a nerve?
It's a two-pronged attack. First, the small vessels that feed the nerves get damaged, so the nerves are basically starved of oxygen. It's a condition called ischemia.
Okay.
And second, the high glucose itself is directly toxic to nerve cells. It just poisons them over time.
And the most common form we see is in the feet, right? Peripheral neuropathy.
That's the one. It causes numbness, tingling, and this is the most dangerous part, a loss of protective sensation. You lose the ability to feel pain.
So you could step on a piece of glass.
And not even know it. And that is the #1 reason why a simple cut can turn into a massive infection and ultimately lead to amputation.
The sources also mentioned autonomic neuropathy, which sounds terrifying. This affects the nerves controlling all our automatic functions.
All of them. Digestion, heart rate, blood pressure, you name it. And one of the most dangerous things it can do is disable your body's warning system for low blood sugar.
So you wouldn't feel the symptoms of hypoglycemia coming on.
You wouldn't recognize the signs. You could be heading straight into a coma without any warning. It's an incredibly dangerous systemic attack.
Okay, so that's the micro level damage, the tiny plumbing. Let's zoom out to the macro, the large arteries. This is where high sugar leads to atherosclerosis, the hardening of the arteries.
And this, you could argue, is the biggest killer. Diabetes just dramatically increases the risk for heart attacks and strokes. One source said up to a 400% increased risk of stroke.
400%? How?
Well, the high glucose just creates this profound metabolic disorder. It speeds up the formation of plaque in your artery walls far faster than in someone without diabetes.
And for the heart, we're talking about chest pain, heart attacks.
Yeah.
But there was a really startling detail in the research.
The painless heart attacks.
Yes. Because of the nerve damage we just talked about, a heart attack can be silent. You don't get that classic crushing chest pain.
It's a terrifying feature, and it means people delay getting help, which can be fatal. And you have the brain, where it leads to stroke, but also, as the research highlighted, an increased risk of vascular dementia.
So long-term sugar control is directly linked to your cognitive health later in life.
Absolutely. And moving down the body, you get peripheral artery disease, poor circulation. This feeds directly into that devastating complication, the diabetic foot.
Which is not just one thing, right? It's a perfect storm.
It's a perfect storm. You have the nerve damage, no sensation. You have the poor circulation tissues can't heal. And you have a weakened immune system. Infections run wild.
A tiny blister becomes a deep ulcer that can lead to tissue death.
And amputation. It's still a leading cause of disability. And we also saw notes about dry gangrene, especially in smokers, where the toes just darken and die from lack of blood flow.
It's just relentless. And it seems to affect every other system, too.
Yeah.
The liver, the skin.
Even mental health. The liver can develop non-alcoholic fatty liver disease. Skin is prone to fungal infections. And there's a clear link to higher rates of depression and cognitive decline.
We should also mention sexual health. For men, nerve and vessel damage often leads to erectile dysfunction.
And for women, it can mean loss of sensation and a higher risk of UTIs. It really is a whole body disease.
Okay, one final point on the chronic risks. The link to cancer.
Right. To be very clear, diabetes does not cause cancer. But the metabolic environment it creates significantly raises the risk for many types: breast, colon, liver, lung. It just increases your vulnerability across the board.
Okay, so that's the slow, silent countdown. Let's switch gears to the acute risks, the sudden emergencies that could happen at any time.
These are the ones that demand immediate intervention, and there are three main ones. The first is hypoglycemia, or hypos.
This is when your blood sugar drops too low.
Way too low, typically below 70 milli-GDL. The brain is basically starved of fuel. The symptoms come on fast, and they are scary.
Like what? What should you look for?
Profuse sweating, a racing heart, headache, slurred speech, confusion. If you don't treat it with sugar quickly, it can lead to seizures and even a coma.
And the second emergency is diabetic ketoacidosis, DKA. This sounds incredibly complex. Can you break it down for us?
I'll try. So your body normally runs on glucose, but if there's not enough insulin to let the glucose into your cells, your body panics. It thinks it's starting.
Okay.
So it starts burning fat for fuel at a massive rate. The waste product of burning all that fat is something called ketones.
And ketones are the problem.
They are the problem. They're highly acidic, so they build up in your blood, and they essentially turn your blood acidic. They poison the system.
And what are the telltale signs of that?
Very distinct signs. Deep, rapid breathing, a fruity smell on the breath, that's the ketones, and severe nausea, vomiting, abdominal pain. DKA is a true medical emergency.
Got it. And the last one is HHS, hyperglycemic hyperosmolar state.
Right. HHS is usually seen in type 2 patients. It's a catastrophic spike in blood sugar, much higher than even in DKA, combined with extreme, life-threatening dehydration. It's just as urgent as DKA.
So this all sounds incredibly grim, but the overwhelming message from the sources is that these outcomes are not inevitable.
Not at all. Strict management can delay or even prevent them entirely. And it all comes down to one thing: blood sugar control.
So if that's the foundation, what are the practical day-to-day things that people need to be doing?
The sources break it down into lifestyle, medical adherence, and just vigilance. For lifestyle, it's about consistency. Regular physical activity, even just 15 minutes a day, a healthy diet, and managing stress.
People often forget about stress.
They do, but stress hormones directly mess with your blood sugar. It's critical. Then there's medical adherence. This is non-negotiable.
Meaning, don't just stop your meds because you feel better.
Never adjust or stop your medication without a doctor's order. The sources actually recommend seeing your doctor and getting key tests done at least 4 times a year, once a quarter.
And what about specific dietary no-nos beyond just sugar?
The big focus is on preventing that macrovascular disease, the heart attacks and strokes. So that means limiting saturated animal fats, trans fats, high salt, and limiting alcohol, which can cause its own problems with hypoglycemia.
And absolutely no smoking.
Oh, absolutely not. Smoking constricts blood vessels, so it basically throws gasoline on the fire of every single complication we've talked about.
Okay, finally, let's circle back to the feet. The care steps are so specific. You mentioned washing them daily in warm water, but not soaking them. Why not?
That's a great question. It seems like a good idea, but with reduced sensation, a diabetic patient could easily scald their feet in hot water and not even feel it.
Oh, wow.
And soaking also dries out the skin, which can lead to cracks and open the door for infection.
And moisturizing, but not between the toes.
Never between the toes. That area needs to stay dry. Moisture there creates a perfect breeding ground for fungal infections, which can break down the skin and start an ulcer.
So the mantra is soft socks, good shoes, and never ever walk barefoot.
Not even in your own house. Any tiny cut or splinter could be the start of a massive problem.
This has been a heavy deep dive, but a really vital one. I think the key takeaway for you, our listener, is that diabetes operates on a schedule. That 5 to 10 year window for chronic damage means that proactive control right now is everything. Every single piece of advice we've talked about is designed to protect your blood vessels.
It is. And that leads to a final thought, a bigger question really. We've established that uncontrolled blood sugar primarily wrecks the cardiovascular system, leading to heart attack and stroke.
Right, which are the top causes of death for everyone, diabetic or not.
Exactly. So the question is, how much of this very specific diabetes prevention advice, the strict diet, the daily exercise, no smoking, managing stress, how much of that should just be adopted by all of us as a universal strategy for keeping our blood vessels healthy for our entire lives?
A really profound thought. It's not just diabetes management. It's a blueprint for long-term health. Thank you for joining us for this crucial deep dive. With this knowledge, stay vigilant, and we'll see you next time.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.